So I'm Olivia Lorello. I'm one of the field service clinicians at New Bolton Center, and I know some of you, but nice to meet everyone else or see everyone else. And I do a little bit of everything. So you'll see me if you ever have to call for an emergency. But I also do, like routine physical exams, lameness exams, and then a large majority of acupuncture and chiropractic now. That part of my practice is definitely growing rapidly, which is fun. So I love talking about this stuff. I went to Penn in 2012, or graduated from Penn Vet in 2012. I then went to New Jersey to do an internship in a sports medicine practice. And that's where I was first introduced to acupuncture. The practice owner's wife would do it and got to travel all over the world with her little needles. And I thought, oh, well, that's kind of cool. I then followed my husband, who's also a large animal vet, to Idaho and got to work on all sorts of animals there, cows, a couple of pigs, and small animals. And then from there, we moved to Switzerland, where I did a PhD following some endurance and eventing horses. And it was equine cardiology PhD. So that was a blast, unexpected kind of route of my career, but ended up being awesome. And from there, went to a private practice in Texas, really busy, great experience, but the South is not for me. So the job came up at New Bolton Center, and finally I told my husband, okay, I'm going there. You find a job too. And luckily he did. So I hope none of you ever have to meet him. He's an internist, and he always sees the sickest of the sick. So, but yes, hopefully I'll see some of you in the field for just routine stuff, maybe some acupuncture, chiropractic. So what I thought I would talk about today is a little bit of the background of acupuncture and chiropractic, and I'll break them down individually and then kind of bring them together in the end. But I wasn't sure what what you guys knew, and so I'll start kind of in the basics, and then if there's something specific you guys want to talk about at the end, I'm happy to do that. So just a little background of acupuncture. To become an acupuncturist in equine medicine, you can go to one of three schools. To get into those schools, you have to be a veterinarian. So if anyone ever offers to do acupuncture, but is not also a veterinarian, it's probably not a good idea. They're not officially trained. And they usually involve a couple of probably 40 online hours and 3 long weekends. So it's certainly not a long training, but you do get through a lot. The basics of acupuncture starts with meridians, which are highways that the Eastern practitioners believe energy flows throughout. They're named after various organs. So you'll hear some of us talk about like, oh, we're going to put this in gallbladder 21 or liver 4. And so those are just meridians and points along those meridians. Whenever energy stops flowing throughout those meridians, you get some sort of disease, whether that's pain like arthritis or systemic disease like a fever or diarrhea or colic. So it can manifest in any way, not just musculoskeletal pain. And then we also talk a lot about balance. So they go back to yin and yang, which I'm sure all of you have seen before. But this balance of light and dark, hot and cold, warm and cool, soft and hard. Balance is health and imbalance is unhealthy, which sounds very simple, but when we get into some of the diagnoses, it becomes important in deciding what acupuncture points to pick for specific horses. So the acupuncture exam can be a little bit different than what some of you might be used to with our regular exams for, say, a vaccine appointment or a lameness exam. We might go through a very thorough history. In horses, this becomes difficult because you routinely don't know the answers to a lot of these questions, but it can be interesting in human medicine and human Eastern medicine. They'll ask things like, what time of day do you like to wake up? Do you like your coffee very hot or just a little bit hot? Or do you like iced coffee? Do you not like coffee? And the history intake form is something like 12 pages long in a typical Eastern Medicine Hospital. So it's very detailed. We do try to get some of that from horses, but again, it's difficult. You don't really know, like, does your horse prefer waking up at 6 a.m. or 8 a.m.? In the person, that's going to make a difference of what points they're going to pick and what herbs they're going to prescribe, but you can't always get that from a horse. But we will ask things like, does this horse like hanging out with people? Does this horse stand alone in the herd? Does this horse like its job? Does it like to go fast? Does it like to go slow? And some of these questions might sound ridiculous, but they can be useful. I'm going to break up the exam a little bit. So probably the most fun part of the exam and what we can do using the history that we took is to put your horse in what's called a constitution. So there's 5 constitutions: wood, fire, earth, metal, water. And I put the descriptors next to those, but some of them are kind of intuitive. For example, fire and maybe earth. And then it's important to know these constitutions. Again, it'll dictate what points we select, and it also gives you an idea of what that animal might be predisposed to. And this can be really interesting to think about some of even the little problems that your horses might have and go back to their constitution and say, like, does this fit? You know, some of the classic earth animal is going to be your Labrador Retriever. They gain weight very easily. Typically, if they have a problem, it usually is related to the GI tract. If you leave them alone, they might worry. Another example, so your water animal would be like a greyhound, right? These little skittish animals that are really shy. They usually do tend to have kidney, bladder problems, things like that. So it can be fun. You can put yourself in this category in these constitutions. And I attached one of the quizzes below. It'll spam your email for a little bit, but you can just unsubscribe and it'll stop. So it can be fun at like a family function or a party to just like have everyone fill this out, and then you can guess, and then it'll tell you what you are. It's definitely been fun within my family and some other get-togethers like field service. Okay, another part of the exam is going to be the tongue. So the tongue, we look at the color, what kind of coating there is, what the shape is, and then each meridian or organ is assigned to a specific part of the tongue. Again, the specific parts of the tongue in a horse is hard because you can't tell them to stick their tongue out. And often when we're looking at the tongue, you'll see us like yank it out of their mouth, and that can kind of change the color, but just another thing that you'll see us do during the exam. Another interesting and unusual part is we'll feel the pulse. So usually in a routine like Western exam, we'll take a heart rate just by listening to the heart, or maybe feeling the pulse on the head. You'll see some of us do that. In Eastern medicine, we're going to feel the pulse or the heart rate at the thoracic inlet there. So like the base of the neck where she has her hands here. And we're feeling, is it strong? Is it weak? Is it thready? There's over 30 different descriptors that you can use. And then we go back to these organ systems again. So each area on the artery is assigned to an organ system. So like the top would be liver. So if the top of the pulse feels stronger than the rest of it, you would think maybe something is wrong in the liver meridian. Probably the most fun thing to do with horses is we call it an AccuScan. So I'll use the tip of my fingers and run them over the neck and the back and the hips and see what areas are sensitive. And these can correlate to problem areas with musculoskeletal lameness. It can be really useful. Like I'll use this even if I'm doing just a regular lameness exam on a client that hasn't asked for acupuncture. I'll use this as one of the things to try to localize the lameness. And there have been a couple of studies proving some of these locations. Others are kind of just like what people have used for a long time, but have not necessarily been proven. And it probably has something to do with, when their foot hurts, they use a specific part of their back differently, and then it becomes sore, right? So there is some logic to this. And then there's some other things that you cannot explain with logic, and you kind of just have to jump in and believe in it. But it's something that's been used for hundreds of years now. So then your horse will get what's called a TCVM, or traditional Chinese veterinary medicine diagnosis. That will explain that your horse either has a deficiency or an excess of something. We might say your horse has stagnation, which is pain. So a lot of the horses that I treat are for musculoskeletal pain. So we'll say, like it could be, carpal stagnation or hock stagnation. And then we'll pick an organ affected. And that's based on, again, what constitution is your animal? What else are we seeing on the physical exam? How's the AccuScan? What does the tongue look like? And the diagnosis will sound totally ridiculous. So for example, if your horse was a 2-year-old thoroughbred filly, just had colic surgery and developed laminitis, the diagnosis might sound something like excess heat or yang excess with spleen qi stagnation. So when we're talking to you guys as clients about these diagnoses, you just kind of have to leap into it and let it go. It's gonna, as opposed to saying his stomach hurts. That's basically the Chinese way of saying his stomach hurts and his feet are hot. What I think is interesting is that while both, so that also might just be like a post-op colic with laminitis. If this pony were, say, like an equine metabolic syndrome pony with laminitis, the diagnosis would be very different in Eastern medicine. So it would be, for example, qi blood stagnation with yin deficiency. So where your Western treatment would be very similar, like laminitis is treated similarly across the board, your Eastern treatments are going to be extremely different. And that's just a huge difference between Eastern and Western medicine. So I just wanted to take a quick break right here. Horses love acupuncture. Like they absolutely love it. I have a lot of, actually just treated one today that, she pretty much hates people, right? This horse, she doesn't like her owner. She doesn't like me. She doesn't like her rider. Like you walk up to her and her ears are pinned. And then she's nice about it, but she's like a lone horse. And then you put needles in her and she falls asleep. It's not this pony, but she falls asleep very similarly to this pony. So we don't do these treatments with any sedation. The sedation kind of numbs it and makes it, it just doesn't work. We're looking for nerve stimulation. So if we give them sedation, the nerves are quieted and we don't get any response. But what this pony is doing here, kind of like falling asleep on the lead rope, is very typical. I would say like 90% of horses, by the time you're done placing the needles, are going to do this. And I don't know if you can see the needles all in his butt here. He's got one in his neck. He's actually got a bunch in his feet, which you can't see in the video, but he probably has like 40 needles in him. All right, so what should you guys call for, right? I think that's the big question everyone has. Like when is acupuncture useful? When is it not useful? When is it worth this money? It's kind of something that's hard to understand how it works, right? It's not just a medicine you're giving, an antibiotic or a refute. It feels very abstract sometimes. So these needle placements are, if you look at the anatomy, most of them are near nerves or nerve branches. And so to me, it makes sense that you put a needle there and you have a local stimulation and you get some sort of response, it ends up being a large endorphin response and again, makes ponies and horses fall asleep. But I want you guys to take away from this that it treats nerve problems very well. So, if you should ever have a horse, this is a horse in this picture with facial nerve paralysis. He ran into a tree. Horses do it all the time. And there's a nerve that goes across his face. And he basically just stunned it. And it's a huge problem. Like you can see he has a catheter going into his eye here because he can't blink. He got an ulcer and he can't protect his eye. He was having trouble eating. He had like a lip droop here. And so we treated him with acupuncture. These, at the time I was using different needles. They're blue here. And this wire is electricity running between different acupuncture points. And I think he recovered in like 6 weeks. So it's not immediate, but he got full function back. He was able to blink his eye. He still had like residual lip droop, but the the big thing was that he could blink his eye and he saved that eye. If he hadn't regained control, we would have had to take the eye out. There's another, it's called Sweeney, but horses have a really superficial nerve over their shoulder that, again, it's frequently like they'll either get scared, run into a tree, or if you don't open the stall door all the way, they'll bang it. And again, it kind of like stuns it, and it causes atrophy of the muscle, or kind of wasting away of that muscle. And there's no Western treatment for it. Like when it happens, people are like, oh no, what are we gonna do? And again, something that with acupuncture, you can build back that muscle and regain function back to normal. It's very, very fun and very cool to watch. So we also often use it for arthritis in all species. This is a pig that I treated at New Bolton Center. And she came all the way from Washington State for our big robot CT that could fit her. She looks actually really small in this picture. She weighed 600 pounds. This picture is not representative of how big she was or is. And she had like an infection in her neck, and it was so painful that she wouldn't like put her head down to eat. And what often happens at New Bolton Center is like they'll treat something, and if it's not going well and they don't have any other medication to use, they'll like call me with my funny needles, is what they say, and see if I can do something. So they called me for this pig, and you'll see like we put some needles in here, and again hooked it up to electricity. All the electricity does is okay, mom's working. Is kind of amplify the response to the needles. And so I do use those in most horses and most animals that we treat. I apologize for that. You don't have to. It will still work without the electricity. So I just also wanted to mention that along with acupuncture, the total like traditional Chinese veterinary medicine treatment might also include some herbal therapy. Food therapy is more for small animals, but occasionally we'll talk about it in horses. The food therapy includes like if your horse is diagnosed with excess heat. So often this horse right here is being treated for something called anhidrosis, where they stop sweating. It's kind of like flares up in July and August when it's just so hot, their sweat glands kind of give out. So those horses respond well to like watermelon rinds and cold foods. I am not certified in food therapy. I just know a couple of things here and there. But there are people, especially in the small animal side, who are like helping develop like what treats are best, and even to go so far as diets, which can be a little bit dangerous, but with proper guidance can be useful. Other things that these traditional Chinese veterinary medicine practitioners will do, tuinya, which is a medical massage. And then kind of one step above that would be spinal manipulation or chiropractic. I think if you do chiropractic, probably the tuinya is not worth it, but I've gone through that certification as well, and can kind of like sometimes we'll combine it, and especially in the kind of more difficult horses that aren't going to allow all of the adjustments, the tuinya is a little bit less intense, and sometimes that will be as effective. All right, so I'm going to talk a little bit about chiropractic, and then again we'll get to why or when you should use both of these. So to be an equine chiropractor, you can be either a veterinarian or a chiropractor. And I like telling you guys these things because I think it matters kind of who you decide to go with. And if you pick a human chiropractor who's gone through the animal training, I think that's just fine. But I think you should probably loop in a veterinarian with what you're doing. And in Pennsylvania, at least, you have to. And so all chiropractors are veterinarians because they're legally supposed to be in direct consultation with a veterinarian. Then a chiropractor probably doesn't want to pay a veterinarian to sit in their truck and watch them adjust horses. So, but there are a couple of other states where they can just say, you know, the chiropractor can call a veterinarian and say, is it okay if I work on this horse? Do you think that's okay? And they say yes, and that's it. I just think that's really good for you guys to know. In addition, there's a certification. So the American Veterinary Chiropractic Association, it requires an exam, both practical and written. And so it's like, it just ensures some level of skill that the person you hire has. And so you can go to the website, AVCA website, and look up an AVCA certified chiropractor. And if you're having trouble finding one, that kind of gives you like a, you know, they've passed like a national exam in both the practical and the written knowledge information. So there's a bunch of schools all over the country, all over the world, actually. And so that exam kind of helps hold them together. All right, so why do we do veterinary chiropractic work? The very basic idea is that pain is caused by lack of motion. And so we do diagnostics, including motion palpation. So we go along the entire spine, usually start at the head and neck, then go to the pelvis and end in the back. And we're feeling for what we decide is normal motion. Now that varies depending on the age of the horse, the body part of the horse, what kind of work the horse is in. And then when we decide, based on that palpation, you'll see us do what's called a high velocity, low amplitude adjustment. So it's like the actual thrust into the horse to try to fix what we think is wrong. All right. I think the biggest misconception is that what we are doing are moving, for example, in this picture down here, can you see my pointer hopefully? We are not moving bones. Like this bone is clearly out of alignment here. That is not a chiropractic problem, right? That is a surgical problem. This human patient is probably in a lot of pain, maybe paralyzed. Like there are definitely spinal problems that are not well treated by chiropractors. And that's where, you know, it's important that a veterinarian is always involved. And all we are trying to do is manipulate the spinal cord to cause the nerves that are running through the spinal cord and branching off of the spinal cord to think and kind of like wake up. So I have this skeleton picture here. We're going to feel all along every single cervical vertebra until we can feel no more. So the shoulder is going to limit us significantly. Once we get past the shoulder, we'll feel all of these backbones here. And then all the way through the pelvis here, you'll hear us talk a lot about the SI region. That's back here with the pelvis. And then we'll do a couple of adjustments on the pelvis. Now, a lot of chiropractors will stop there, but myself and quite a few other people will also manipulate the limbs. And the idea behind that is to just increase mobility near the trunk of the horse. So you're not really adjusting parts of the leg as much as you're helping relax muscles on the core of the horse so that the spinal cord and those nerves coming off the spinal cord can function correctly. So this hopefully will make sense in the coming slide. All right, so here's a picture of the spinal cord, and it's surrounded by a vertebral body here. And then on the other side, so like deeper into the animal would be a disc. And so there's, tons and tons of nerves branching off the spinal cord. They are required to function properly so that the horse knows where it's putting its leg. Now that kind of sounds stupid, right? Like obviously the horse knows where its leg is. That's not true. So, you know, if the horse is tripping, it doesn't know where its leg is. If it's not extending all the way, it doesn't really know where its leg is. Maybe when you cross over, it doesn't do it smoothly. So the complaints we'll hear of things that we can treat with chiropractic range from everything like, oh, he doesn't like the right lead canter to, you know, we know he has cervical arthritis. Can you help him? And those can all be pretty well treated or helped by chiropractic. So the kind of core chiropractors believe that the two most important areas to adjust are the atlas, that's the pole of the horse, and the pelvis, and everything else is kind of bonus. So I'm going to show you what this looks like. All right, so the atlas is the picture on the left. We'll kind of stand behind the head and wiggle it around and decide which way it's tight. Almost every horse needs some sort of atlas adjustment. I think it just goes through a lot of tension in day-to-day activity, and especially in sport horses. Then we'll go down the neck of the horse. There's 7 neck bones that we'll feel and adjust as necessary. Something you'll see me evaluate on almost every horse is called a pelvic lift or a butt tuck. This horse is doing an awesome pelvic lift. So you'll see he's raising his lumbar muscles here, so lower back muscles and upper back muscles. He's really symmetric. He's really well muscled there. So how I'm doing this is I have my hands on both sides of his hips, and I'm putting a fair bit of pressure kind of right in the middle there. And this is something that you guys can do to your own horses as like a rehab or kind of physical therapy. Most horses that are in some sort of work, I think, you know, including driving, unless they're asked specifically to do so, do not use their back correctly, just like how I'm slouched in my chair right now. Like it takes, you know, like gravity is kind of against all of us, and it's way easier for a horse to walk around inverted, but their back will be much happier if we can strengthen the muscles along it, right? So core strength, and you'll hear human athletes talk about this too. So then we'll decide, you know, what to adjust in the pelvis. So we'll feel both sides of the pelvis from the ground. Then we'll climb up on this block, or maybe 2 blocks if the horse is really tall, and feel like the sacrum or the sacroiliac joint. We'll use this block to go up and down the back or the thorax, and feel it in all different directions. Another thing you can do if you're comfortable with your horse is something called the tail pull. So you ideally stand directly behind them, although recently I've kind of modified my technique where I stand facing the opposite way of the horse and kind of like pull away from him or her. So you want to make sure that the angle you're doing this is kind of following the natural angle of the pelvis. You don't want to be pulling straight out, and you don't want to be pulling straight down. And you can put a fair bit of pressure, like I lean most of my body weight in the opposite direction of the horse. And you know, it feels good because most of them lean forward. So they're leaning like away from you to help pull even more. And what this does is loosen everything from the pelvis to the back. Some people believe it loosens it all the way up to the atlas. I just can't like quite make that leap myself, but maybe. And so I'll do this in every horse before I adjust the pelvis at the back, just so I have a little bit more in my bag of tricks to get them adjusted. They have a lot of back muscles, and if they're tense, it's really hard to adjust them. And then I'll feel the front leg. So we're doing these stretches back and forth. And again, I'm not that concerned with all these little bones in the foot and the leg. I'm more thinking about how can I stretch out the horse at their core here and help those, like loosen up the muscles around the neck and the muscles around the ribs and the muscles around the pelvis. So what are you going to use this for? Primarily lameness. And again, it can be everything from an actual lameness, so horse is limping around the ring, to, gosh, my horse just like always lands on the right lead and I want the left lead, or my horse turns so well to the right but doesn't turn well to the left. My horse has trouble stopping. My horse has trouble starting. My horse goes around with a head tilt. So the complaints are numerous. Every once in a while, we'll do this for performance or behavior. So some sort of, we believe there's like a chronic pain and the horse is really all of a sudden irritable and no one knows why. Maybe we've tried giving them bute and the bute helps, but we take them off bute and they are uncomfortable or kind of cranky again. Then an exam like this might be useful, assuming it's not, again, an obvious lameness or swelling somewhere. And lastly, but maybe a little bit controversial, is for neurologic problems. And I say controversial, I myself don't believe this is controversial, but I've had a little bit of pushback from other practitioners, just like believing that it's okay. So an example would be like lower neck arthritis. A lot of horses, and especially sport horses, struggle with that. They'll get injections, they'll do MagnaWave, they'll do massage therapy, and chiropractic might sound a little bit scary, right? Like, oh my gosh, if there's extra bone and arthritic changes there, like, should we be doing chiropractic? I believe we should, because I believe it's very safe the way that I was taught, which is, again, we don't sedate these horses for these exams. If it's really painful, they're going to tell you. And if they're unsedated, they can protect themselves. So I think it's really useful to get the range of motion going in these horses and you know, help build any muscle that might help support these areas that have arthritis. So specifically for back pain, there is a lot of data supporting it in horses, which is great. I think a lot of people don't realize how much information and how many studies there are supporting it. They're kind of like, oh, chiropractic, no one does that. We don't talk about it in the veterinary curriculum, or we haven't until I got here. Now we do, which is exciting. But very specific studies, right? We're measuring muscle mass, we are measuring nerve flow, and it is shown to be very effective in treating back pain. Laminitis is very well treated with acupuncture. It kind of depends what sort of laminitis, but as I was talking about in the beginning of the lecture, we're putting all of these needles near nerves, and you're creating kind of a local inflammation response. So you're improving blood flow. Often laminitis is caused by either too much or a lack of blood flow. And we can treat both of those things with acupuncture. These horses, very laminitic horses, also do significantly better with frequent chiropractic adjustments. Now you're not necessarily treating the laminitis, but you're helping all of that tension above, where, you know, if they're so painful that they're so tense all the time, you can help relieve that. And I do think that you can help long-term outcomes. I just wanted to put a plug out for, we have a chiropractic study going now. So if any of you do things other than unfortunately, it's not for driving horses, but if any of you do any kind of hunter jumper or even like low level hacking around, we are putting devices on horses, measuring gaits and heart rates and all sorts of things. And then you get a free chiropractic adjustment for your horse if you ride them with this device. So I just wanted to leave the end of the talk open for, you know, if you guys had any questions, specific cases that you were wondering about, or other treatments for acupuncture. Again, the majority of what we treat in the field is sport horses that they want to keep, you know, at their prime, but certainly there are a lot of things it can be useful for.
Hi, can you hear me?
Yes.
Hi, my question is, I have a sport horse and we're kind of in the process of doing a little bit of everything. You know, he gets kind of quarterly massages and we're leaning towards starting some acupuncture. And I guess my question is, and then hearing about the chiropractic stuff that puts my mind at ease a bit more about how that works. But how much is too much, and how should I like connect all the people that are doing various different things on my horse?
Yeah, that's a good question. I think it depends a little bit on the horse, right? Like some horses just love all these treatments, and then you feel like, well, I mean, maybe there's no such thing as technically no such thing as too much, but do you are you know what? Probably some of the practitioners would also be able to tell you like he doesn't need a massage every day, but I run into that problem a lot with chiropractic because some of the again, these sport horses, they're like looking for they want any edge, right? And they're like, oh, maybe we should do like weekly adjustments for a while. And you go see the horse and you're like, this horse doesn't need it. Like you feel the horse and they feel fine and they don't need it. But that is like a very individualized question because it depends on personality of the horse. It depends on how hard the horse is working, right? So if the horse is going on a couple trail rides a week, maybe twice a year adjustments is going to be great. If the horse is competing, in these crazy combined driving events where they're like getting yanked in all sorts of direction around a turn through water, then, maybe once a month is better for that horse. Yeah, I don't know. It's hard to give you a very specific answer because it's so variable.
No, that was perfect, because then you just don't want to make sure that you're, buying into something that, that you don't want to do too much, but if the horse likes it and you're seeing a result, then that makes sense.
Yeah, they should be. I think all of these modalities, the horse should appear to be enjoying it. Like that's the nice thing about doing it. That's actually why I just love it, because aside from, you go and you like vaccinate them and they don't like that, and you float their teeth and they don't like that, and you inject their hocks and they're like kicking at you. You do this stuff and they're like, you're all of a sudden you're like their best friend, and they'll tell you when it's too much. Again, like those neck horses, we have a lot of those in the practice, and they'll tell you like if you're doing it incorrectly, if you have the wrong angle, they'll say like no. So I would think it would be the same with massage, and definitely the same with acupuncture. I saw a question from Jamie. Can you do acupuncture and chiropractic at the same time? Yeah, I do that all the time together. My preference is to do chiropractic first. And again, this is primarily for the sport horses, but would probably also apply to the sick horses, like the laminitic horses are the ones I think of the most often. We'll do the adjustment and then put some needles in, and then you really maximize your effect. That's actually why I did the acupuncture training first, and I had so many clients asking, they said, well, we're looking for someone who does both. So it's very common.
I have a question. It's Debbie. Do you find the horse's reaction to either the acupuncture or the chiropractic? I know we recently had a clinic with a clinician who has been trained in the Masterson method of body work. Mm-hmm. And she talked a lot about really watching your horse's response to certain, going down the bladder meridian, for example, and watching, going very slowly and watching any response to any particular area, which would indicate a release of tension or some kind of release. And I was wondering if that's similar with either the chiropractic or the acupuncture, where you actually can see a horse responding to specific points that you've, stimulated either with the chiropractic or the acupuncture.
Yeah, that's definitely true with the chiropractic. I'm almost always like, if I find a spot that I'm trying to adjust, I almost always will kind of keep going until I get a response. And the very simple one is like a lick and chew, and the kind of one everyone strives for is like a full body shake, which is very uncommon in horses. It does happen. But they will like shake their head quite often, and those are really good responses. The acupuncture, I don't think that it's needle specific, but again, when all the needles are in, they'll be doing the same thing. Like their head will drop, they'll be licking and chewing, and that kind of tells you've hit enough of the right spots. But I don't think they do, or maybe I just am too focused on like what needles I'm placing. But I think it's not always needle specific for that. I mean, you'll get reactions. Like there are, I say they should like it, but there are definitely some acupuncture spots that they don't like as it's being placed. So they'll like squeal or kick or stomp their foot. You know, it's a needle going near a nerve. So, but for the most part, it's like kind of a one-off, you know, like that kind of hurt, and then they let it go. So I almost never, now I'm going to jinx myself, but like my restraint is just someone holding the horse. Like I'm rarely putting a twitch on in any way, like no nose twitch, no neck twitch, no nothing. Maybe in some of the more sensitive horses, like I've got a couple of 3-year-old stallions that just like won't sit still until the needles are in. We'll just like rub their neck or something, or kind of distract them. But it's all, I try to make it all pretty positive, like a positive experience. And yeah.
Okay, thanks.
Yeah, the Masterson, that's interesting. I worked with someone who did that, and I hadn't taken the chiropractic course yet, so it didn't all make sense to me, but now I would be curious to hear about that again.
Yeah, that is very interesting.
Hi, it's Tracy. I also was introduced a number of years ago to chiropractic and acupuncture, and I have seen an amazing result with all the animals that I've had worked on. And I think what can be accomplished is, I mean, like the most incredible night for me was a really heavily colicking pony in the middle of the winter, older fellow. And I thought it was fascinating to see the needles hooked up to electric stim. I think if you're seeing it for the first time, I think you might be a little skeptical about what's happening. I know I was, but the end result is, and correct me if I'm wrong, is that the needle actually accelerates its use because the stem's being attached to it. So that meridian point or that targeted area that you're trying to work on to relieve the stress or the pain or the issue actually is enhanced by the stem. And I've had that done on myself. And I was like, oh my God, they're hooking that up to what? But the end result was really satisfying for both me personally and also the pony. We saved it from being put to death that night because he was really badly colicking. So don't be afraid of an electric stim. If your veterinarian comes out to put needles in your horse, don't be afraid of it and ask lots of questions because it works. So I think the electric stim was a little intimidating for those people who have never seen it before.
That's really good to hear, Tracy, because now that I use it almost every day, I like whip it out without much thought. So it's really good to hear that can be, and it totally makes sense that that's a little bit intimidating to see someone like hook your horse up to electricity.
Yeah, I mean, it amps up what you're trying to do in a shorter period of time. And sometimes depending on the level, and there are levels, correct me if I'm wrong, there are levels of stimulation that you can attach to those needles, like I'm making it up 1 to 10. Where you can tolerate a certain level. And you know, like when it was hooked up to me, my acupuncturist said, now, how's that? Can you take that? And you wait a couple of seconds and see, and it's like, that's getting a little heavy. Or nope, I can do a little bit more, because the more that you can do in the shorter period of time, I'm relieving. It happened to be a back issue for me. And it was initially a little arresting to like feel that. And then if I did my little breathing and dealt with it, I could. So it was like, and I watched it happen with the horse where we just amped it up and amped it up. And I've watched it with horses more than once, but this one night was really specific. And it was very helpful to see that. So I think if you've never had it happen to you or happen to your horse before, I think it can be rather intimidating. Let it happen. It's terrific. And to your point also, I think it's really wonderful because the horses do tell you what's happening. And if you do hit a nerve and they are kicking the wall, it's not necessarily the practitioner's problem. It's because that nerve is so sensitive and really does need to be adjusted. And you need to find another avenue into that nerve to help that particular animal, is my understanding of what happens when you get a quick result like that. Because I did have a horse that like kicked the ceiling in the barn.
Yeah. And
Yeah.
sometimes all we are looking for, like sometimes if that happens and they don't kind of let it go, we'll take the needle out. And that doesn't mean that it was like a failure of the needle, but maybe all they needed was like needle in, needle out. I didn't get to talk about some of the different, like other different kinds of acupuncture, but sometimes we'll inject things in. So usually we inject like vitamins in these spots, and that can be something. So some horses are really sensitive to the needles, but if you inject this vitamin in the spot that you would have put a needle in, it'll have a stimulating effect for a couple of hours, similar to acupuncture, kind of like a low stimulation. Another thing that might be, I'm glad you said that, Tracy, because it might be a little bit weird that you'll see us do is we'll bleed some points. So I have a bunch of people who laugh at me because I'm like, oh, good, we got blood. And then they're like, you're the only vet who's like happy to see blood. Because in some things that we treat, it's considered good to like relieve. That's a way of relieving the stagnation, so to speak. That
So laminitis was an
oh
issue.
yeah.
And
Yeah.
so we had the pony, exactly to your point, we had the pony have the acupuncture done, and we were really happy that we got the reaction of the blood, so we're relieving the
Mhm.
pressure in that hoof.
And was it the dark blood? Like often it'll be this like
Almost
dark, almost like brown blood, and then it'll bleed and it'll become brighter, and that's like the sign. I mean, it's back to like the medicine of
it's like
bleachers.
maple syrup to blue blood. Yeah.
Mhm.
So, I mean, I think those are really important things for those people that haven't experienced that, to understand that is normal for this kind of procedure. And it has helped many, I mean, I've used acupuncture and chiropractic for probably 25 years. And I am so glad that you're doing it, and that it's available to our community to have that happen, because it has been helpful in so many occasions. So, and also most of our driving club people, many of them, unless they're minis, Jamie's not riding her ponies, but a lot of us ride our horses. So we do have some animals that may or may not fit your chiropractic study.
Yeah. Feel free to email.
And this is Jamie. Can you guys hear me okay?
Yes.
Okay. Sorry, I'm doing this on my phone. And I just wanted to say Olivia's worked on my horse Splash, who's a sidewinder. We don't really know why, but sometimes he just walks sideways behind, probably from neck arthritis or something. And he tends to be a fidgety, kind of grumpy horse. But the second he has those needles, and especially if he's got the electric stimulation, he's like a totally different animal. He relaxes, he goes to sleep. And he had been on various medications and anti-inflammatories when it first started. They helped for a period of time, but the only thing that will make him look clinically better if he's having like a flare up, like when it gets cold, is acupuncture. And so it does work. And I actually do it, have it done with my dog as well, who has urinary incontinence. And it helps, like every few weeks she has to have a touch up, or, you know, it might be every 6 weeks. And it just, even with the medication, you don't get it at the same results that you get from the acupuncture. So it's something that you can't believe it until you see it. So
Yeah, Splash is a great example.
yeah, I think he might need some chiropractics with his acupuncture this
Yeah.
fall.
Yeah,
So
he looks so good, Jamie. Like I saw him the other
Oh,
day in the
good.
field. He looks awesome. Yeah.
well, thank you, because of you. Thank you. It's a great talk. Thank you.
Here's my email. If any of you guys want to reach out about the study or anything else, and I mean, I know Tracy and Debbie and Jamie know how to get a hold of me anyway, but any horse, the exercise you have to do is about 20 minutes or so. It's like 10 minutes of walk, 10 minutes of trot, but it can a little longer than 20 minutes. It can be broken up, and then 2 minutes of canter. That's the only inclusion criteria.
And is that on the website, or that you just put up? I mean, I'm looking at the chart right now, but is that something, if somebody wants to contact you, that?
The study's not on the website, but I can, my email is on the.
Okay, so you can send that to someone who might be interested in participating in the study, is what you're saying?
Yeah,
Okay.
yeah.
And then I don't know if you have the answer to this, but I was introduced several years ago to orthobionomy. And no?
No.
Okay. I'll get you that information. There's a woman in Australia that founded that. So and there was a clinic that was right down the road from New Bolton.
Oh.
And you know my black mare Lippy, she was a participant in that weekend when she was 3, and she's now 15, so that's how long ago it was. But it complements what you're doing. It's almost an opposite to chiropractic, where you sort of come away versus going into. And it's fascinating. So I'll get you some information on that, and I will get you in touch with a woman who's much more well-versed in the information than I am. But
Interesting.
it's another body modality that's fascinating, that I think you would enjoy learning a little bit more about, since you're totally into this.
Yeah.
I thank you
Great,
so
thanks.
much for this fabulous presentation. Thank you.
Okay, you're welcome.
Thank you very much.
Yeah, this was great. Thank you.
Yeah, thanks again.
Good, you're welcome.